Greetings, friends and followers. This is Nurses Talking. I am Dale Barzy. As always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey. Today, it is my very, very great pleasure to welcome Barbra Bachmeier out of Indiana, USA. Barbara is a nurse practitioner. She's an advanced practice forensic nurse. She's an attorney. She completed her master's in public health in May of this year, 2024. She received the National Emergency Nurses Association Practice and Professionalism Award in 2015. Was selected as a fellow in the Academy of Emergency Nursing in 2018, and she's retired from the U.S. Army National Guard after 29 years. So welcome, Barbara.
Thank you, Dale. It's a pleasure to be here this afternoon with you.
It is my absolute pleasure. And as I read that, I said, my goodness, this woman has been busy.
Sometimes time flies very fast. I mean, it's hard to believe that it's been a 42-year career.
But what started you on this path?
Well, actually, I was kind of like one of those guideless, I guess, teenagers when I was in high school. Didn't know what I wanted to do. My mother was a nurse. My father was a contractor. He built homes, remodeled, and he was also a farmer because I was born and raised in North Dakota. My mom worked shift work. I always thought, God, that's just terrible. You have to work weekends, holidays, nights, and all that stuff. That isn't what I want to do. And I guess what really changed my mind is I went into the military 5 days after I graduated from high school. I went to my Army basic training, and then I did my advanced individual training at San Antonio, Texas for 6 weeks as a U.S. Army medic.
Yeah.
Which later on I got my emergency medical technician, and I really liked it. I thought, well, this is very interesting, the healthcare field, and providing emergency care to patients. I really like that. So I decided to go to practical nursing school. So I started off my career as a licensed practical nurse. I graduated in October of 1982? I think I graduated. And then several months later, after I received a job as an LPN, I started back right away with my bachelor's in nursing, knowing that it was something that I would want to move forward with and become a registered nurse.
Awesome. But you came to nursing with a background in from the Army, which is very, in my view, like very, very regimented. So the transition from Army life to working as a civilian and then as a nurse, how was that? Did it present any challenges for you?
Well, one thing that the military does, regardless of what branch that you belong to, it really teaches you discipline. I mean, and it really gave me a purpose in life, because like you said, it's very regimental. You're on schedules, you have expectations. The thing about the Army approach was if you do something to hurt yourself, you're not motivated, or you're not completing the mission or doing something like that, you affect your teammates too, and your workmates. And they really build you as a cohesive unit, in the military. So you never want to disappoint anybody, because you'll end up affecting someone else and hurting their career or their opportunity, to complete a mission. So I came out very, headstrong. Obviously, I was disciplined in that type. As far as being at work on time, completing tasks, and missions, my assignments and things like that. And of course, I continued to stay in the military while I was going through actually my LPN training, my RN training, my advanced practice training, my become a lawyer training. And then, of course, my postmaster's in not only when I got my advanced practice nurse, registered nurse, that was a master's in nursing, but I've completed my MPH. But that was after I retired from the military.
Wow, that's been a lot. That's been a lot. And you are an advanced practice forensic nurse.
Yes.
So for our viewing audience, what do forensic nurses do?
So really, forensic nursing is like the intersection of healthcare and law. So to start out the basis of just that general definition, we are nurses that are specially trained to work for patients that have been affected by or inflicted by trauma. And that people always think of trauma as in a physical type of trauma, which we do also, but also we work with the psychological trauma. So we work with patients that have experienced interpersonal violence, such as domestic violence, sexual assault, child abuse, neglect, child abuse, neglect, elder abuse, neglect, human trafficking, strangulation. So those are just, some of the areas that forensic nurses can work with that particular patient population. So keeping that in mind, that it's a very specialized niche in nursing. It's very unique because when you work as a forensic nurse, you actually work with quite a bit of community collaborators. You have community partners. Typically, for an example, caring for a patient of interpersonal violence who's experienced sexual violence, you work very, very, very close with community advocates, local law enforcement, and the prosecution. So that itself is, you not only have to have really good nursing skills and assessment skills and critical decision making, but also it's a very independent role because it's not a very big unit. If you work it's usually just you. So you have to be there making decisions on your own. Of course, you have colleagues that you can always call and talk to, but for the most part, you're juggling with three other worlds in advocacy, law enforcement, and of course, prosecution that you have to be very knowledgeable about. So it gives you a lot of exposure to the community, but it's a wonderful community service to be able to provide care to a patient that has experienced interpersonal violence, because you just, you have to have somebody that really cares about this, how patients can be affected by physical and psychological trauma and deal with that.
Yeah. And so is that what sparked your interest in public health?
It was. It actually was. Because as you know, violence is a public health issue. And that's been since the 1980s, when the Surgeon General announced, in the 80s that, especially gun violence is a public health issue. And how things have been handled in this country when it comes to gun violence, we've put everything on the criminal justice system, and that is the worst place to put who owns this. I get it that, shooting someone and carrying, having a handgun with that, it's not lawful to carry one. Of course, shooting someone and definitely killing someone is a crime. But when it comes to education and prevention, it's like, what can we do about this? It's us in the community where we live. And really to approach it as a public health, because this is, it's going to affect a population of people. And that's where I feel that, the whole social determinants of health really, really play into the healthcare of a patient. Now, mind you, 42 years, I have been individualized care in the emergency department, episodic care. You come into me with elevated blood pressure or a headache, some other signs and symptoms. I'm going to deal with that patient in front of me. But when you talk about public health, you have to look at the population health. Like right now, Indianapolis has a pretty high homicide rate for per capita. So we have to look at that population, like what can we do as a community to mitigate this and eliminate, gun violence or patients and victims experiencing interpersonal violence. So yes, public health was a huge, my background in forensic nursing was a huge precursor for me, and a motivation to continue to get my master's in public health.
Yeah. And as you were talking about, it being a community issue and it being us who is going to who need to be on the ground in affecting change in this area. And so I'm thinking of, you mentioned education and stuff like that, and policy making.
Yes. and I think it's really, I always thought to myself, oh, I'm not really one of those policy analysts or things like that. But when you see what's happening in your community, I mean, the violence that's happening, it's almost like a moral and ethical obligation that you have to be at the table to deal with this. I was so proud of our institution at IU Health here in Methodist in Indianapolis that we started up a hospital-based violence intervention program where we're bringing, someone that has experienced what our patients have to the bedside to work with them to help mitigate any future violence in that individual's life, or to get them on a road to recovery where they can, thrive. So it is important, especially for nurses, because we are the ones that have initial contacts with these interpersonal violence patients. One of them, most of us is, of course, doctors too, but I really feel passionate that healthcare needs to take more of a role in the public health issue of violence. And we should be at the table along with lawyers and other policymakers and government officials.
So you just kind of answered the question that occurred to me as you were speaking.
Yeah.
Because I was just about to ask if you thought that there were enough, if you think there are enough nurses at the public health table. But you're saying that you think there need to be more.
Oh, absolutely. Absolutely. Because, especially when you think about public health, it's all about how health promotion and prevention. Now, my concentration was in social and behavioral sciences, but still, I mean, when you think about interpersonal violence, absolutely, when it comes to educating patients and the public and victims, nurses are especially trained for that because that's how our brain works and that's how we're educated. So we absolutely need to be at the table when these decisions are made because we care for these patients 8 to 12 hours a day. When they either come in through the emergency department or they're admitted through the hospital, or they're seeking services out in the community, which requires healthcare supervision and administration of some type of implementation of some type of healthcare service. So we absolutely should be there and we should be running it.
And you mentioned all the other people at the table, and I'm thinking that you came to this with armed on two sides, because you came armed as a nurse and you came armed as a lawyer. You came armed as a lawyer, right? To this table. So this is I'm coming here.
Well, as part of the forensic nurse, our obligation is if we are required to go to court to testify on as the healthcare provider giving care to these patients of interpersonal violence. And, the criminal justice system is, designed, to bring justice and restoration, to someone that has been wronged. But notoriously, victims of violence have been stomped on, and sometimes the outcome of a court decision is not in the favor of the victim.
Yeah.
And we have to be prepared of the long-term sequelae of that. Victims of violence will suffer, long-term psychological sequelae. And we're going to be there for them, and that we're going to see them again in our practice, and out in the community. So again, that's one more reason that nurses will have a vested interest in how this all plays out and how our country will deal with the violence.
Yeah.
Not only violence, but all other aspects of violence. And
well, I was about to say, because there is a lot of it that is very overt, but there is also some that's very covert as well, and we don't often see that as an issue or as a problem, or even approach it in some way to try and address it.
Well, one thing that comes to mind is human trafficking, because that is a covert crime. You know what I'm saying? And we see so many of those patients probably on a daily basis, and we ask the questions, but sometimes we don't pick up on the subtleties of what they're saying to us and dive into more. And that's where I really feel that sometimes the social determinants of health are a really good starting point, especially for us in the emergency department, but also for primary care, sitting down with them and going over the social determinants of health and see what is going to be a problem for them. And I'll give you an example. a gun violence patient, maybe hospitalized for a couple of weeks while they're recovering. Now, if it's a musculoskeletal involvement, they may require physical therapy and things like that. Well, let's sit down and talk with the patient. So when you discharge, are you going to have a safe and secure environment to live in? And once you're living in that area, if you have follow-up care with the physical therapy appointment or the trauma surgeon, how are you going to get from point A to point B? Considering those transportation issues and really digging down deep with the patients to determine what do I have to work on now for this patient in order for them to move forward, heal in their physical injuries, but also help them with the psychological trauma that they experienced.
Yeah. And you mentioned something so very profound. You said sometimes you miss the subtleties.
Yes.
Yeah. So let's move a little bit. What do you think, if anything, you'd like to see change about nursing or the way we deliver care or anything?
So let me see. That's kind of a loaded question. So some of the things that I've thought about is, number one, there's recently been a national organization that has come alive, and that's Nurses for Reimbursement. I don't know if that's exactly the name of it, but I really think that instead of us being the nursing care being covered under room charges or general care, that nurses actually are reimbursed for the care that they are provided. Now, right now, with medical forensic examinations for sexual assault or domestic violence patients, that can be reimbursed at through the criminal justice system. But I'm talking about these women that don't want to pursue and participate in the criminal justice system. So they're not going to pay for the care that they've received. So at that point, then you have to look at other alternative means. But if there's no means for reimbursement, a hospital is not going to invest a lot in a forensic nursing program when it's not a moneymaker. You know what I'm saying? Because they have bills to pay too. And unfortunately, if we as nurses could explain our value, that everything that we do and we're able to document it, I really feel that was one thing I'd like to see change, that nurses are actually being reimbursed for the care specifically being provided. Probably another issue that we've got to get a solution on is our staffing crisis. And that has a lot to do with supply and demand, maybe not all nurses going into nursing school because of the cost of it. And there's just not a good reimbursement, like when somebody goes into medical school or becomes an attorney, you know what I'm saying? Because their wages are going to be higher, and that's not the case for nurses. So therefore, nurses going into nursing school aren't as abundant as what they used to be. And then also you don't have the professors to teach in those nursing schools because financially, that's not always a good thing for nurses, especially if you're a PhD or a DN. You got to look at the cost value of you going into a university. Is it going to be, help me support my family? You know what I'm saying?
Exactly.
Yeah. So that's the second thing I'd like to see changed, is the staffing, crisis, the nursing crisis, and also, the education of training nurses, that we've got to do a better job of becoming a professor in a school of nursing attractive. And also the third thing I would like to see changed is that where nurses need to have a seat at the board table, and actually run the boards or be project leads on healthcare. So those are kind of the three areas I'd like to see change for nurses over the next decade.
I think I see the new lot of nurses coming in, and I'm a little bit heartened. I'm a little bit excited about their point of view, because the things that were acceptable to me as a young nurse is certainly not acceptable to them.
Right. Yeah.
And you just said a while ago, as you were talking about that, you said something that really resonated with me. You said we have to learn to explain our value as nurses, which I think is true. But I think that we get so really caught up in the nursing thing that sometimes I think we don't even actually know our value. We have not actually internalized what our value is.
Right.
So if we don't do that, we're not going to be able to explain it.
Right. Well, and plus, if it's not being recognized as a value to the, patient care, it's just like,
right,
in wound care, nurses do those wound care dressing changes every day. Like,
all the time.
Especially wound nurse that comes by maybe once a week or whatever like that. But who's really responsible for those dressing changes and assessment of the care is and turning of the patient not to make the wound any worse? You know what I'm saying? Our nurses, and that's not being reimbursed. The specialty wound care nurse, which by the way, she should be reimbursed for their specialty care. But I'm talking about there's nurses that help that wound heal, that we're not being recognized as actually contributing to the recovery of the patient.
Yeah, actually making it happen.
Yes.
Yeah. So now I have to ask you, what is your big vision? I look at your your accomplishments. You're an attorney, you're a forensic nurse, you're a nurse practitioner in ICU, you do all of these things. So what is your big vision for you?
Well, currently that we have a forensic nursing program at IU Health. I started in as a forensic nurse back in 1999, and we were only caring for patients of sexual violence. 2010, we decided to expand our practice to include all patients of interpersonal violence. And for about 6 years, we really struggled with staffing, people coming and going, because it was hard to keep people because there was no support with it. The institution, everybody thought it was a great idea to provide this care, but no one wanted to fund it, like everything else, kind of like the laws that are passed in this country. Everybody thinks they're a good idea, but there's always unfunded mandates. Well, this is, no different. And let's take it, trauma is not a money-making for an institution. I mean, it just isn't, but it needs to be done. It needs to be done really well. If we hope the patient to recover. So my vision is already we've gotten a hospital-based violence intervention program. That was my focus during public health. I did a project on that, working with our trauma services, and they made to come to fruition, which is huge. We work with them because we see the same type of patients. We're providing services on our end, and they do kind of like long term of like when that patient leaves the hospital. I would like that relationship to flourish and continue more, where we're actually being more ingrained with the trauma services and with the hospital-based violence intervention program. I would like us within the hospital here to expand our services out in the community. So if we get like something comes up at a community clinic that's affiliated with our institution, that we would be able to somehow sit down with that patient and troubleshoot while they're at the clinic, as opposed to having them come into the ER and get an emergency department visit. Okay. Right now, we do offer telesane services where we sit down with a patient from another institution and talk to them about their options, about if they want a medical forensic exam for the sexual assault. We ask them about their reporting options. We talk to them about advocacy. We talk about what treatment options are available through them. So we're actually doing telesane with patients that have not come to the emergency department, because sometimes those patients do not want a medical forensic, but they need all the other services. So I would like to see that expand outside of IU Health, where we're currently at, because right now we just have the capability within our 16 hospitals to do that. But I would like to see that expand, especially to the Department of Corrections. Speak with prisoners about the trauma and abuse that they experience in there before being transferred to a hospital, only to find out when they understand what a medical forensic exam is, they don't want it. You know what I'm saying? So that's what I like to really expand forensic nursing service to, not only expand it outside their institution, but I want to see it spread throughout the state. And hopefully big healthcare institutions will see that as a value of being able to expand those services to educate their community partners that we really do have something to bring to the table and to this patient population. Yeah,
that's huge. That's huge.
Yeah, it is. And I'd like to see us being a training site for forensic nurses. And we received a $1.3 million HRSA grant. So we are doing that now. We're training nurses to become forensic nurses. And we're going to be doing a clinical fellowship. So a nurse can actually work with us on live patients, real time, what it looks like to do a medical forensic exam and help build their competencies and actually validate that they are competent to perform a medical forensic exam on their own with a patient who presents with sexual violence. So not only become a regional training institution, but also to expand the clinical services outside the hospital.
Absolutely awesome. Absolutely awesome. I have two questions.
Yes.
Both of them about you.
That's
What do you
very
do?
cool.
What do you do for self-care? What do you do for you?
Well, and I'll be very honest with you. I have never been good at self-care. Because part of the thing with the military, you're always operating at a very high up tempo. Especially, I had 2 deployments. I mean, you rarely got any sleep, and it was always about the mission. So unfortunately, that has kind of led into my professional life as a nurse. And our profession in itself, we work weekends, nights, holidays. And so sometimes our families and even our own goals and desires sometimes take a second seat to our job. I mean, I think that's just who we are as nurses. We're kind of altruistic in that manner. I'll admit I'm not good at it. I think I've gotten a little bit better over the years. I think the one thing is that a nurse needs to be comfortable saying no, especially when you're like asked to do community presentations or to take on a project or something like that. I highly encourage every nurse to be involved in their professional organization. I think that should be a must if you ever expect to grow as a nurse. But at some point, like myself, you put a lot on your plate, and then all of a sudden it's just like, oh my God, how am I going to meet all these deadlines? So learning to say no is probably a good thing. And maybe being good, I need to be better at prioritizing of, what I should be dealing with. And also, I think doing things for yourself, even though it may be considered splurging, I think that it's important that you sometimes just take a day for yourself, whether that's meditation or you're going to the spa or you decide to splurge on some type of skincare product to stop the aging process or whatever. I think that is important. I think my saving grace is what I consider self-care is I'm very, very dedicated to my family. I have this huge extended family. I have 5 siblings. I have 15 nieces and nephews, and I have 26 great nieces and nephews. Never miss a birthday of any of the nieces and nephews or great niece. I always send them a gift. And I always try to remember them on their special day, because when you have that big of a family, sometimes you get lost in the mix. One day I want them to know how special they are. That brings a lot of joy to my life. So, self-care can be actually still engaging in your family and enjoying that. I know some people say, well, as grandparents always say, oh my God, it's just wonderful being a grandparent. Well, it's like, God, you never were that joy when I was growing up. So it's like, I'm looking forward. I have 2 stepchildren, and I am looking forward to having grandchildren one day. I never had children of my own, but I have these 2 great, stepchildren, and I'm looking forward to being a grandma. And they're going to call me BB, not grandma.
I get that. I get that. You have the word worked out and everything.
Yes, I do.
Okay. The idea though, when you were talking about having, 15 nieces and nephews and 26 great nieces and nephews, you reminded me immediately of my own grandmother, because this was her big wish, actually. She had 10 grandchildren, And her big wish was always she wanted to have us all at her house at the same time.
Yeah.
And, and she would say, make as much noise as you want.
Yeah. There's something very cathartic about that. You know, I was saying this, like my mom, who lived to be 100, she passed away on August 8th, and we went home, and pretty much 14 of the 15 grandchildren were there, and almost half of the great grandchildren were there. And we had housefuls all the time. And it was very nice to hear that laughter and the camaraderie and,
Yes.
the family gathering. It's very good for the soul.
Yes. Nothing beats it. Nothing beats it.
No, I agree.
So one more question, because I've been collecting these words, and I'm asking if you could tell me what you see as the most essential quality of a nurse in one word, what would that word be?
I would say dedication.
Dedication. Okay.
And
Yeah.
and just going beyond your general work, environment, that, like I said, belonging to a professional organization, have it in your mind that it's going to be a lifelong learning for you. I'm not talking about everybody needs to become a graduate, graduate level educator.
Mhm.
I'm talking about never stepping back from an opportunity to learn about something. I mean, test your boundaries. And, I've spent most of my career in emergency nursing. And I did other things too. I did pre and post-op outpatient surgery. I did ICU. I did med surg in my early careers and things like that. But, I always encourage nurses, I said, step outside your comfort zone. If that's one thing I wish I would have done more, is maybe explore in other areas of nursing. But like you said, I mean, once you find your niche, Dale, nursing is my love, and forensic nursing now is encompassing most of my professional career right now. I do still work as a nurse practitioner in seeing general emergency department patients, but for the most part, I'm focused on forensic nursing. And, I got about another 7-8 years left, I think, in the field. So, I'm going to concentrate on that area, but I think be dedicated to the profession. I mean, help it advance.
Yeah. As you said, be committed to continued learning.
Yes.
And I really believe that if to truly be an effective nurse, you have to. There is no way you cannot learn. There's no way you cannot learn. If you're there, you better be learning something.
Yeah. And, be involved in your unit wherever you work. Take on some little additional project, not a lot, just, take on one that, helping write policy and procedures, or becoming involved in unit-based counsel or something like that. Going to get you involved and do more than your 12-hour shift, I guess, is what I'm saying. And I know a lot of people don't want to hear that because they always want to be paid for their time. And I get it, that every time is valuable, but there's things over the years, and that's how I feel about community volunteering. Everybody should be volunteering in some aspect of their life, whether it be dogs or with elderly or with, doing meal trains or, whatever. I mean, community volunteer work is a must in any profession.
Unless you're so very isolated, then being involved in your community is it is cathartic in a way. It is cathartic in a way. Yeah. Barbara, thank you so much for this conversation. I have truly enjoyed it. You have educated me so much. Thank you. Thank you.
Well, thank you so much for having me. I'm honored that you picked me out of thousands of people to be on your Nurse Talking. It's lovely that you're doing this. I really appreciate you helping getting the profession out there, and so people can understand the different aspects of nursing, because it is so
it's so vast and diverse. Yes. I want to get rid of that tunnel vision.
Yes, I hear you. And us to become leaders in this country when it comes to healthcare and actually have a voice.
Yes, indeed. Thank you so much, Barbara. It's been a pleasure.
You're welcome.